Hysterosalpingography, also known as uterosalpingography. Here we see the lining of the uterine cavity, the shape and patency of the fallopian tubes. It is done in assessing the fallopian tubes on the 8th or 10th day of the periods. It is better to do in the first half of menstrual cycle. It is a simple OPD procedure. X-ray is done where the patient can take his meal and immediately gets the report. Procedure is mostly over within 10 minutes and can easily go home and eat other normal food. In rare cases, there might be some complications. Then, like severe pain, bleeding, and severe cramping, then should report to their doctors. Mild pain and slight bleeding, these are very normal after the procedures and need not worry and settles in few days. Few doctors also prescribe painkillers like and antibiotics just one day before the test. So you can take these for 3 days, before the test, on the test, and 1 day after the procedures. Here, what are the informations we get? We can get whether the fallopian tubes are patent or they are blocked. The shape of the uterine cavity, sometimes there is a biconduit, septate, or there might be some filling defects that can be made out. There might be some hydrosalpinx, or there is a fimbrial blockage or cornual blockage. Now, how the procedure is performed? We take help of a very simple HSG catheter. Few people do it with HSG cannula, but nowadays simple these plastic tubes are available and this is a painless procedure. Some patients who are very apprehensive, we try to give them cervical block. Here the bulb is inflated. Just then, can you see in the picture, this is the way we insert the catheter, and just on the top of the internal os, we inflate this bulb with the air, simple air, 1 ml, 2 ml air, so that it sits on the internal os, and then nowadays non-ionic water soluble contrast medium is pushed so that it outlines, and then the contrast media spills towards the both sides. This is how the X-ray films are available. This you can see, it is a normal hysterosalpingography pictures. What can you make out? You can make out the outline of the uterine cavity. Here the simple bulb is sitting here, and here the free spillage has taken place. So this is a normal picture. Now what are the other complications which we can understand? This is, you can see, this is here you can see that bilateral cornual blockage is there, and this is the Asherman syndrome. Sometimes there is adhesions within the uterine cavity, unicornuate uterus with the big blockage at the fimbrial blockage, and this is showing the hydrosalpinx. I will show you another X-ray film which we have taken, and here you can see how beautifully this is a cornual blockage on one side and here it is a spillage. So these are the different things. In case patients experiences any complications, then there must be something wrong. In majority of cases, it is a very simple procedure. There is some advantages, like it has been seen that 50 to 60% patients of unexplained infertility, they usually conceives within 3 months after the HSG procedure. Let us discuss what are the contraindications of HSG procedure. Of course, pregnancy. So therefore, it is done in the first half of menstrual cycle. If there is a severe bleeding or severe pain and there is indication of some infections. Hope this video will be helpful for you and you will get these informations. You will subscribe our channel Dr. Kavita Mantri in the YouTube. Thank you so much.